All right, let's dive into one of the most misunderstood conditions out there, migraines. We're going to break down the real science behind what's happening in your head and, more importantly, how the different treatments out there are designed to stop the pain.
So let's get the biggest question out of the way right up front. Is a migraine really just a bad headache? I mean, that's what a lot of people think. But the science, it tells a completely different story.
And the answer is a hard no. A migraine isn't just a simple event. It's a process. Think of it like a vicious cycle that just keeps feeding itself, where your nerves and inflammation are basically in a feedback loop.
And that's exactly what we're going to do in the next few minutes. We're going to walk you through that cycle and show you precisely how different medications are built to jump in and break it.
So, first things first. To defeat the enemy, you have to understand the enemy. What exactly is this cycle, and why on earth does it feel so relentless?
The key phrase to know is neuroinflammatory condition. Now that sounds complicated, but think of it like this. Your nerves get overactive, which causes inflammation. Then that inflammation turns around and makes your nerves even more sensitive and overactive. It's a downward spiral that lowers your pain threshold until even normal things like light and sound feel like an assault.
And here's that cycle in action. It kicks off when a major nerve pathway, the trigeminal nerve, gets triggered. That nerve then releases a cocktail of inflammatory chemicals. Those chemicals make the blood vessels swell up. And that swelling creates this intense hypersensitivity to, well, everything. And guess what? That hypersensitivity just fires up the nerve all over again. And the cycle just keeps going, getting worse each time.
Okay, so if inflammation is half the problem, it makes sense that one of the main strategies is to, fight the fire directly.
This is where your common NSAIDs come in, non-steroidal anti-inflammatory drugs. They all work by putting the brakes on inflammatory chemicals, but they're not all created equal. Ibuprofen is like a sprinter. It's fast-acting and great for a quick rescue. Naproxen, on the other hand, is the marathon runner. It lasts for over 12 hours, which is perfect for those migraines that just refuse to leave. And if you've got a sensitive stomach, celecoxib is specifically designed to be a bit gentler.
But here is a massive warning. Using these medications too often can seriously backfire. You can end up with something called a medication overuse headache or a rebound headache. This is one of those cases where more is absolutely not better.
So what happens when that cycle is just spinning so wildly out of control that NSAIDs can't even touch it? Well, for those truly awful multi-day migraines, doctors have a much bigger tool they can turn to.
We're talking about steroids like prednisone. These aren't for your typical migraine. This is a rescue mission. Think of it like calling in the special forces. Instead of targeting just one chemical, they come in and do a system-wide shutdown of the entire inflammatory response to break that cycle by force. But because their effects are so widespread, they're strictly for short-term, emergency use only.
Okay, so we've talked about fighting the fire of inflammation. Now let's flip to the other side of the coin, calming the electrical storm that's happening in the nerves themselves. And for that, we have a class of drugs called selective serotonin receptor agonists, but you probably know them as triptans. I know, the full name is a mouthful, but just think of these as precision-guided missiles designed specifically to take out a migraine. Let's actually break that name down. It's not as scary as it sounds. They're selective because they only target the specific receptors, the little docking stations on your nerve cells, that are involved in a migraine. They work on serotonin pathways, which help control your blood vessels. And they're an agonist, which is just a fancy word for something that turns on that receptor to get the job done. See? Simple.
So what do they actually do? Triptans deliver this amazing one-two punch. First, they constrict those swollen, throbbing blood vessels back to their normal size. At the same time, they tell that trigeminal nerve to stop dumping more inflammatory fuel on the fire. They hit both sides of the migraine cycle at once.
Now, a really important safety point about triptans. Because they constrict blood vessels, a feeling of chest tightness can sometimes be a side effect. And while that can be a known effect of the drug, it is something you should never just dismiss. It always needs to be checked out just to be safe. All right, so we've got meds to fight inflammation, and we've got meds to calm the nerves. But what about just dealing with the awful symptoms, like the raw pain or the nausea? That's where supportive care comes in.
And a perfect example is acetaminophen. It's totally different from the others because it doesn't really do anything about the inflammation. Instead, it works inside your brain to basically turn down the volume on the pain signals. So it's not fixing the root cause, but it can make the whole experience a lot less agonizing.
And please remember this.
Non-opioid does not mean no risk. Acetaminophen is processed by your liver, and taking too much can be extremely dangerous. You have to read the labels and respect the daily limits.
Antihistamines can also be surprisingly helpful, but it's all about using the right tool for the right job. The first-generation kind, like diphenhydramine, can get into your brain, which actually makes them great for easing nausea and helping you get some rest. But the second-generation ones, like loratadine, they don't make you drowsy, so they're better for handling any allergy triggers that might be setting off your migraines in the first place.
Phew! Okay, we have covered a ton of ground. So what's the big takeaway here? How do you actually use all this information to manage migraines in a smarter way?
Well, it really just comes down to 3 golden rules. Number 1, act early. The sooner you get in there, the easier it is to stop that cycle before it gets out of control. 2, avoid overuse. We gotta dodge those rebound headaches. And 3, know your risks. Understand the medication you're taking and how it affects your body, your stomach, your heart, all of it.
And that really is the most important thing. Just understanding that a migraine is a cycle and not just a headache is a huge first step. The next step is taking that knowledge and having a much smarter conversation with your doctor about finding the right tools to break your specific cycle. So, now that you get it, what's your first step going to be?